Hello, in our last video we talked about acute low back pain. That is, low back pain that was probably caused by something you did. Remember? Acute low back pain is usually due to a soft tissue injury and generally resolves itself in 4 to 6 weeks.
Today, we're talking about chronic low back pain. That is, pain that focuses itself on the lower part of the back and sometimes one or both legs. About 8% of Canadians suffer from it. Often, it is not possible to determine the exact cause of chronic back pain, but it is possible to rule out some worrisome causes, such as infection, cancer, or pinched nerves. Unlike acute low back pain, chronic low back pain does not resolve itself quickly. If it lasts longer than 3 months, it's chronic. The amount of chronic pain that you feel depends not just on what your nerves feel, but also on your emotions, memories, and thoughts. It's very personal, and it's sometimes accompanied by depression or anxiety. Be sure to talk to someone about how you're feeling.
Unfortunately, the longer you have this pain, the less likely it will be cured or it'll go away completely. Now, that doesn't mean that you have something that requires surgery or other invasive therapy or it's life-threatening. And it also doesn't mean that there's nothing you can do about it. So, stick around.
And despite what many people think, chronic low back pain is most often centered in the muscles and ligaments surrounding the bones of the spine, not the spine itself. Sure, discs do get compressed and other spinal damage can occur, but that doesn't account for most chronic low back pain.
Unless the medical professional you're seeing suspects spinal injury, he or she will not be ordering any MRIs or X-rays. These tests cannot tell the difference between a person who has back pain and a person who does not. These tests really cannot see pain.
Naturally, a lot of people who suffer from chronic low back pain worry that their medical professionals have missed a curable cause to their discomfort. Of course, this may be possible, but as diagnostic tools and techniques improve, it is less and less likely. A good clinical history and examination will raise any important information you need to know about, even if it doesn't come from Canadian Tire.
By the way, here are some of the medical professionals who are trained to treat and evaluate those with chronic low back pain.
Family doctor, chiropractors, physical therapists, and osteopathic physicians. The following are not: garage mechanic, 7-Eleven clerk, your Aunt Grace, that girl at the health food store.
Now, there's no one magic bullet that can help everyone with chronic low back pain, because everyone is different, and often it's a combination of interventions that can help. Let's look at what research has shown can be beneficial to people with chronic low back pain. But keep in mind, total pain relief often isn't possible, but every little bit can help to improve your life.
First, stay active and exercise. Don't do anything that will twist your spine or put pressure on your lower back. But gentle, controlled exercises like this one can really help.
Second, learn some simple pain coping skills such as relaxation techniques, including breathing exercises and yoga. Most people find cognitive behavioral therapy, or CBT, valuable. It's a combination of coping skills, relaxation, and learning how to take control of the pain. Qualified psychologists, occupational therapists, social workers, nurses, and trained laypersons with special training can help you learn CBT. Also, these sessions are held in group settings. Try and maintain a normal lifestyle. You have control. Set realistic goals and think of how to do things differently. Be creative when working around your condition, and don't be afraid to ask your family and friends for help.
Third, you might consider exploring acupuncture. It's not for everyone, but it might work for you. Check with your healthcare expert first.
Fourth, massage. If you combine a professional massage with activity and exercise therapy, it can be beneficial.
Fifth and finally, there are some medications that can be helpful. We've got Tylenol, we've got ibuprofen, we've got Motrin and Advil that can help manage pain. Now, for short flare-ups from muscle spasms, muscle relaxant can be very effective. Now, if you have severe pain, we have narcotics that can be administered under careful medical supervision.
Notice we didn't mention surgery. There are very specific chronic low back pain conditions that can be treated by surgery. Most often, it's not a good idea and certainly not the first option, especially if the pain does not extend into the legs. For most folks, gentle exercises and painkillers will be more helpful than surgery. So that's a lot of info. Let's do a quick review.
Chronic back pain focuses itself on the lower part of the back and sometimes one or both legs. About 8% of Canadians suffer from lower back pain. If back pain lasts longer than 3 months, it's considered chronic. The amount of pain can be influenced by your emotions, memories, and thoughts. It can be accompanied by depression or anxiety. Talk to someone about it. Chronic low back pain is most often centered in the muscles and ligaments surrounding the spine, not in the spine itself. MRIs and X-rays can't see pain. Diagnostic tools are very good at ruling out curable causes of chronic low back pain. Family doctors, chiropractors, physical therapists, and osteopathic physicians can diagnose chronic low back pain. There's no one magic bullet. A combination of interventions can often help. Here are some. Stay active. Learn some simple pain coping skills, such as relaxation, cognitive behavioral therapy, and other ways of taking control of the pain. Acupuncture. Massage and exercise, a great combination. Medications can help, even some narcotics in extreme cases, administered under careful medical supervision. That's it. We hope that's given you a better understanding of chronic low back pain. Thanks for watching.